Hi, I'm Pekka. I'm trying to learn medicine, today anxiety, and after we've done with it, we're gonna do squat training. And if you participate in the squat training, then it's at your own risk. And we're talking here about psychological thing, and this is no medical advice. We're just reading about it, and that is part 3. And now we're trying to gather the informations together, which we heard here, and when we try to prepare a presentation, and when we try to make the presentation. So anxiety. Anxiety is a state of, and that book is from the 70s, so maybe some things are better now. No. A state of uncertainty, worry or fear that is not only perfectly normal, but is usually also a necessary part of performing any difficult task well. There are 4 main factors which determine when anxiety becomes a medical problem. Okay, the main thing here said is anxiety is a state of uncertainty, fear or worry. And some anxiety is completely normal when performing a difficult task, but it can be also a bit stronger, and that is not completely normal. Or at least is then not a medical problem. If the symptoms of anxiety are unpleasant, the sufferer will want them relieved or present them to the doctor as evidence of a serious physical disease. I don't really understand what that sentence means, but I think that means 2 things. The first thing is, if a person reports to a medical doctor that they're having anxiety and feel not good about it, that is already a sign that it is stronger than normal. And also the other thing is that they're presenting it as a physical disease. That they're feeling it as a physical problem, but I don't really get that part. We're not going to make it completely as a book, because we just want to say basically what anxiety is in our presentation. We're going to stay a bit away from what is area written here. We're going to keep it precise, but vague, so not at the same time. 2, we are usually worried by the symptoms of anxiety only because we are unable to link them with their cause. Thus, so we're talking about human beings. Thus, we may accept feelings of nausea or an attack of diarrhea before a driving test or an important interview because we see the link between the symptoms and the cause. On the other hand, we may report the same symptoms to the doctor if the cause is more distant and less easily defined. For example, a long-term but understandable anxiety about a child, money or job. This inability to link symptoms and cause often makes us feel, quite wrongly, that we are imagining our symptoms. Okay, saying here, if people have anxiety before they have a difficult task, or before they have an exam or a job interview, then they know they feel anxious because of it, and they understand it basically. But sometimes people are worried over a longer time over their children, over their financial situation, or their job. And then they can't really understand why they are anxious, because they can't link these 2 things together. And that would be in chronic anxiety, I think. This inability to link symptoms and cause often makes us feel quite wrongly that we are imagining our symptoms. That makes, can I say that? What does it mean? That makes some people think that they are imagining the symptoms. Because they can't link them, they just think they have just anxiety. But actually, in this book said, they have something else in their life, they just don't know it is because of it. At that point I want to add a little story. We had a previous part in medical, where they told a hearsay story. I'm going to tell it again, I don't know if it's true, but it is the story. But people who have, I think it was in the part of POTS, whatever. When they stand up, and normally if people stand up, I don't know if it's true, that the blood circulation to the legs goes for a little moment a bit off or something. So that there's enough blood in the head when they're standing suddenly up, and they don't get dizzy and fall over. And that there are some people by whom this mechanism does not properly work, and they don't shut up and they get a little dizzy. And because they're now a little dizzy and so on, they feel a little unwell, their body releases adrenaline, so that the body says fight or flight or whatever. We're getting nauseous. I don't know what nauseous is actually. I said it a couple of times. They're getting dizzy and they don't feel that good, and the body releases adrenaline, so that they say get power basically through adrenaline. And this adrenaline is then not just in the body for 10 seconds until the blood is again circulating good and the people are again clear, but that adrenaline stays for minutes in the human body, not just as long as it needs to get the blood running properly. And just because they have now a lot of adrenaline in the body, they feel anxious. So having a lot of adrenaline in them and they feel not anxious. I don't know if it's true. I don't know anything about it, but that story was very important, because if it is true, that would be a reason for anxiety. If people feel anxious because they have adrenaline in them, without that they have a psychological reason, or that they have something in the world which they can't link to it. That would be a physiological problem. But they don't. I just wanted to tell the story. I don't know if it's true. I don't know the things about it that's true, but I just remembered that story that I wanted to say it here. There would be something that people feel anxious, and it is not imagined, but it is also not because something in their life, and not psychological. They are just anxious. And I think we have medications against this, whatever. But you get the idea. And number 3, doctors are only beginning to understand how anxiety about everyday life can cause the physical symptoms described below. These symptoms are not imagined, but are like rocks that only show up when the tide goes out. Through the action of endorphins, chemical compounds found in the brain, fatigue, boredom, ill health and worry can lower the tide level of our consciousness and expose the physical symptoms of anxiety, including pain. So if a person basically has trouble in their life, fatigue, boredom, illness, or a sudden death case is the next example, then basically their tide level, whatever now is meant with it, goes down, and they feel now their anxiety also as pain. The symptoms are listlessness, I don't know what it is, weakness, fatigue, headache and head pressure, tenseness, nervousness, irritability, depression, usually at night, unexplained pains in any part of the body, dizzy spells, deep sighing breaths, panic or palpitations, nausea, vomiting, diarrhea, frequent passing of urine, insomnia. If, for example, someone at work dies from a sudden heart attack, several anxious workmates might, unknown to each other, report unexplained palpitations, chest pains or discomfort to the doctors. Similar, someone caring for someone else. It is pretty complex to explain what is written here. Through the action of endorphins, some things like fatigue, boredom, health and worry can lower the tide of our consciousness and expose the physical symptoms of anxiety. Through the action of endorphins, chemical compounds found in the brain. So through the action of endorphins, fatigue, boredom, ill health and worry can lower the tide. Okay, one explanation is that there are endorphins. Let's look if they have endorphins written in this one. Endocrine system, endometrius, epiglottis, endorphin, no, entropion, and eye condition, in which the lower lid and lashes turn inwards. It is not a dangerous condition, but is uncomfortable and causes sore, watering red eyes. Endocrine system, but we have not written like that directly. Okay, we're gonna say that things like fatigue, boredom, ill health and worry can let the person have more endorphins. That is what I understand from it. And so they are more likely to feel, I don't understand all the complete part, and more likely to feel the anxiety also as physical things like pain, headache, insomnia, palpitations, depression, tenseness, irritability, and so on. If, for example, someone at work dies from a sudden heart attack, several anxious workmates might, unknown to each other, report unexplained palpitations, chest pains, or discomfort to the doctors. I don't understand how that example explains it now. No, it would be fatigue, boredom, ill health, and worry itself. Worry can lower the time. Do we mean that worry can release endorphins in the brain, which makes the consciousness higher and exposes also and lets them feel the physical pains of anxiety? Now that would be interesting. They say at another part, we don't have time. They say at another part that basically the people don't know why they are worried or anxious, and that they're getting now worried and anxious about it. Why are they anxious? And now vicious cycle starts, so we say in this book, they are worried why they are worried. And at that place they're saying that worry or fatigue, ill health or boredom can release endorphins in the brain. So worry itself can release endorphin, which makes a person feel their physiological things of anxiety, or feel anxiety more, and then also physically. Now, this is no medical advice. I just read this book and I try to understand. That is what I understood. I don't know if it's right. If you were here for medicine, you can go directly to the next part of medicine. We don't have time. But if you stay here and participate in the squat training, then it's better the honest. And we'll bring one leg up. Point with the toes. Other leg up and point with the toes down. And now the legs wide apart, and we're doing 12 squats. So first one, and the second one, and the third one, and number 4. And let's go strong to the half, at a 5 and the 6 waving the half. And let's go on to the second part, 7 and 8, and with 9, we're almost there, with 10 waving the 10, and the last two, 11 and 12. And now the 6-pack squat squeeze. Legs wide apart, go down into quarter squat, press against the top of the leg. And the same on the other side. Down into half squat and press against the middle part of the leg. And on the other side. Down into 3/4 squat and press close to the knee. And on the other side. And up again. And now, the fastest giraffe of the water pond. Again down into 3/4 squat, press against the knee and go towards it. And on the other side, press against the knee and go towards it. And again, press, go towards it. And again, press, and go towards it. Again. And again. And last two. Last exercise, the propeller. Down into full squat, arms wide open, go to one side, press against the leg and look up to the head. Little bend in the elbow. To the middle, over to the other side, press against the leg and look up to the head. To the middle and up. And now a bit stretching. Again, one leg up, pull the leg up, point with the toes down and relax the leg. Other leg. Pull the leg up, point with the toes down, relax the leg. Now take the leg at the ankle, make a straight back, and point with the knee down to the ground. Other side, take the leg at the ankle, straight back, and knee down to the ground. And legs wide apart, breathing out. And breathing out. Again, in and up. Out and down. Breathing across the legs. And breathing out. That was the squat training. I thank you very much.